Hi, thank you for checking out this video on what do you do when you're suffering with thyroid symptoms but your labs are all normal. My name is Dr. Kevin Smith. I'm the founder of Integrated Metabolic Solutions located in Bethel Park, Pennsylvania, near Pittsburgh. My clinical focus is in metabolic conditions such as thyroid problems. I'm a speaker, writer, and clinician, and I've been in practice since 2001. I'd like to welcome you to this video. So, what is the thyroid and what does it do? The thyroid is a small, butterfly-shaped endocrine gland that's located in the front part of your neck. Its job is to function like the accelerator or brake pedal of your car, speeding up or slowing down the function of everything in your body. And by everything, I mean literally every single function. Every cell in your body has a receptor on it for thyroid hormone. That means that the thyroid gland directly affects the function of everything. If it's malfunctioning, it can cause trouble elsewhere. So as I said, the thyroid gland regulates the basal metabolic rate, and that speeds up or slows down the function of other parts of your body. Every cell in your body is going to be affected by thyroid. The basal metabolic rate is kind of like the accelerator or the brake pedal of your body. And just like with a car, when you press on the accelerator, the car speeds up. When you press on the brake pedal, the car slows down. That's exactly what the thyroid gland does. It directly affects how quickly or how slowly everything operates in your body. Your thyroid gland is a master regulator, and that means that it can control and regulate the function of other stuff in your body. So what happens if the master regulator itself starts to malfunction? A sick thyroid can wreak havoc, and it can cause problems and disruption elsewhere in your body. Here's a list of some common thyroid symptoms: fatigue, lethargy, brain fog, poor memory, headaches, depression, nervousness, irritability, aches and pains, heart palpitations, weight gain, the inability to lose weight even with diet and exercise, dry, brittle hair, difficult or infrequent bowel movements, dry skin, insomnia, thinning of the hair, and low libido. If you can say yes to 2 or more of these symptoms, you probably have a malfunctioning thyroid and you should get it checked. Now, most people, they go to their medical doctor for help if they think that their thyroid's malfunctioning. And the medical doctors typically order 2 lab tests to check for thyroid function. The first test is called TSH, which means thyroid stimulating hormone. And the second test that they'll order is T4, or thyroxine. The problem with only ordering these 2 tests is that they give you an incomplete picture. They do not check the entire thyroid metabolic pathway. All they really do is to qualify you for artificial hormone such as Synthroid. Replacement thyroid does not cure thyroid problems. All it does is it regulates the amount of T4 in your body. You can have normal T4 and still suffer with thyroid symptoms. This pathway shows the hypothalamic, pituitary thyroid axis. The process starts up here in the brain with the hypothalamus. The hypothalamus secretes a hormone called TRH, or thyroid regulating hormone, that then acts upon the pituitary gland. The pituitary gland, also in the brain, secretes a hormone called TSH, or thyroid stimulating hormone. When TSH reaches the thyroid gland, it causes the thyroid to produce T3, triiodothyroxine, and T4, or thyroxine. T3 then needs to go to the liver or your gastrointestinal tract to be converted to T4, the activated form of thyroid hormone. Thyroid metabolism is complex, and it involves numerous organs. The process can break down anywhere along the pathway. Medical doctors, again, only check one area of this pathway. They check for the TSH-T4 feedback loop. They do not test for problems in other related areas, such as the pituitary gland, the hypothalamus, the liver, the gastrointestinal tract, the adrenal glands, etc. There are numerous components to this process, and it is not enough just to focus on one part while ignoring the rest. That would be similar to a building inspector checking the electrical and plumbing only while not paying any attention to the foundation, the roof, the furnace, windows, the doors, the chimney, the flooring, the attic, the appliances, etc. I think you get my point. There are numerous interrelated organs that are critically involved with this process, such as the liver, the gastrointestinal tract, such as your stomach and your small and large intestines, the brain, the adrenal glands, the pancreas, and the ovaries and the testes, which produce the sex hormones, such as testosterone, estrogen, and progesterone. The health and function of all of these different structures must be taken into consideration if you have a sick thyroid. We have a free 5-part email course called Why 90% of Thyroid Patients Will Never Get Full Symptom Relief from Thyroid Replacement Alone, and What You Can Do About It. To get access to this free 5-part email course, please visit us online at www.integratedmetabolic.com. Thank you very much for checking out this video.